You are listening to part 90 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Hi, Gemini. I'm so happy to be here. And it's really, such strange territory for me to do so much research and to learn so much about surgery. After I had my tonsils out as a child, I thought, well, good, I'll never do that again.
Right.
Right? And I think that's kind of how most of us feel about surgery, right?
Yes.
Yes,
definitely.
well, let's never do that. And yet, there are times when we need that surgery, or we think we need that surgery, or we are electing to have that surgery. And so let's keep ourselves healthy. One of the things that I mentioned before that was very distressing to me as a person in her 20s studying was teachers that I had who would just out of hand dismiss people who had had surgery or chemotherapy and say, well, herbs can't help you now because you've ruined yourself.
Oh, gosh, that's harsh.
And that's one of the reasons why I said, wow, I don't want to be alternative. I don't want to engage in wars. I want to be complementary. Right? If someone feels they need surgery, they should do surgery. They should ask all those questions we talked about last week, and that was a pile of questions, wasn't it?
Definitely, yes.
Many people I talk to, they say, well, my doctor did this test, said I needed surgery, referred me to the surgeon, and that it was scheduled for the next week. I'm like, whoa, there are very, very few instances where it's really helpful to schedule surgery that fast. I learned this when I was researching more than a decade ago for breast cancer ? Breast health ! And I was talking to a lot of women who, had had a biopsy and it came back cancerous, and they said, we have to do the surgery immediately. And yet every specialist that I talked to said you can easily wait 2 weeks. And so, the panic button, I find, and most people that I talk to tend to agree with me, that the panic button doesn't take me to places that are well thought out. What about for you, Gemini?
Oh, definitely. I could certainly see where, in a moment of panic, you wouldn't make decisions while you were rational, for sure.
So, give yourself that time. I have found that most doctors are worried that people are going to refuse treatment, but if they're actually given a time limit, they're not so worried. I hear you. You think that I need this surgery. I need some time to think about that. Do you think that if I took a month to think about that things would get worse for me? Do you think it's reasonable for me to take some time to investigate alternatives and to try them out? These are questions that we can ask our healthcare providers, and many people tell me that their healthcare providers are actually in a good mood when they get these kinds of questions. Again, they don't have to worry that you're not going to follow up. They have a time, and they can actually answer your question. Well, yeah, you probably do have 2 weeks, or yeah, you probably do have 2 months, or yeah, this condition doesn't get worse a whole lot faster. If you want to take this amount of time to try some alternatives, we can certainly do that before we opt for surgery. So your doctor or your surgeon doesn't want to talk to you that way, that's a big clue that you need to find a different doctor or a different surgeon. This is your body and your health that we're talking about here. And so it's important that you have people to work with that you feel secure with, that you have faith in, not just people that you like, okay, you can like them, but what's more important is that even if you don't like them, you have faith in them. I went whitewater rafting once with somebody I had a great deal of faith in, although I didn't necessarily like the way he did things. And there was one moment on the trip when we were heading full tilt boogie toward this huge stone cliff, and I thought, oh, broken bones ahead. And he picked me up by my shirt and dumped me on the other side of the raft, causing the raft to veer away from the stone wall. And I thought to myself, yeah, that's why I trust this person. His methods may be really crude, but they get the job done. And yelling at me to move, well, you know, I might not have moved fast enough. Picking me up and depositing me where he needed me. It worked. Zoom. We were out of danger. Find a surgeon and find an anesthesiologist that you feel safe and secure with. Research has found, says Urli Avitsur, MD, that the more often a surgeon has done a particular procedure, the lower the risk of complication and death for the patient. You know, it's true. Interns have to practice. They have to learn. But on me? On you? Not so sure about that. Once you have decided that you do want or need the surgery, there are other surprises in wait for you. You may spend a lot of time with your surgeon going over things, feeling confident in your surgeon, only to discover afterwards that your surgeon didn't do the surgery, that your surgeon supervised an intern or a student learning how to do the procedure. We're going to talk about that consent form that you have to sign when you consent to surgery. And we're going to talk about how you can add a statement to make sure that it's actually the surgeon that you've chosen who's doing the surgery. So why wait? You know you're going to have to sign a consent form. Don't wait until you get to the hospital the day of the surgery to read the consent form. Needless to say, you're probably not in a mood to read a lot of small print, fine details, so ask for the consent form as soon as you agree to the surgery. As soon as you set a date for the surgery, ask for the consent form for the hospital where you are going to be. Now, understand that your surgeon is probably not affiliated with just one hospital, but has operating privileges in a great many hospitals. So you not only want a consent form, you want the consent form from the hospital that you will be in, and you want to speak to and choose an anesthesiologist who works in that hospital. If you ask for a copy of the consent form as soon as you set the date for surgery, then you can take it home and read it. And then you don't have to read the whole thing at once because it's very boring, legalese reading. And this gives you time to ask questions about anything you don't understand completely. My father gave me good advice, including, you're a nice-looking woman, don't get on motorcycles. Very good advice. But even better advice was, don't sign anything until you have read and completely understood what you are signing. I know this seems silly, and my photograph is taken frequently for large projects that people are doing, and so there are consent forms, and they are always surprised that I take the minute, 2 minutes, 3 minutes, 5 minutes it takes to read their consent form. And I almost always have a question, and I almost always mark something off and initial it and have them initial it that I don't agree to. You're not required to sign the consent form, and you're not required to agree to everything on the consent form, especially not the add-ons. You think you're going in to have X done, but the consent form can have a blanket statement saying, and any other surgical intervention that seems necessary. Really? I was quite shocked once to hear over here, I was at a conference, two surgeons talking, and the female surgeon said, well, I was doing a laparoscopic procedure of tying her tubes, and I was just curious as to how her liver looked, so I snaked my camera up there so I could get a look at her liver, and I'm thinking, oh my gosh. Well, I certainly don't want them looking at my liver, especially if we don't need to look at the liver. So those people agreed on their consent form to whatever the doctor wanted. If you don't, mark it out and tell your doctor so they're not looking at your liver when they're supposed to be tying your tubes. One way to be sure that the surgeon that you want is doing the surgery is to write that surgeon's name in on the consent form. If it's not written in, then it's not a given that that surgeon will do it. So add a statement that you are consenting based on the surgery being done by, and give the full name and the title of the surgeon, initial that, and for best results, have your surgeon initial it too. That consent form is far more important than you might realize. Most of us, if we're having surgery, are a little apprehensive, and reading a long form is not high up on our list of things to do. So what I suggest that people do is that you look at that and you think, reading this document may save my life. It's kind of the way I talk to myself when I'm doing my taxes. I was blessed when I was pretty young to be very close with a woman who had a certified public accountant file her income tax. And that certified public accountant made a mistake, and that mistake was found by the IRS. And they were not only demanded that she pay those back taxes, but a humongous fine because it was quite a few years in the past. And I said to her, well, the CPA had to pay, right? And she said, no, I had to pay. And I said, what? She said, yeah, anything that's done on your tax return, you're the one who's responsible for it. And I said to myself, okay, if I'm responsible for it, then I'm doing it because I'm responsible for it. And, of course, I complain and groan and moan like any sane human being would be. And my answer to my complaining and groaning and moaning is you're saving yourself hundreds, if not thousands of dollars. Just get to it, and it will soon be over for the year. But back to something less threatening than taxes, and that is surgery. We have discussed questions that you need to ask about whether or not you need the surgery, and now you have decided that you need the surgery, and the very next thing that you're going to do is to get a copy of that consent form and make sure that you are only consenting to what you want to consent to. All right, next item on our agenda is check out the hospital. We've checked whether or not we really need the surgery. We've decided on a surgeon that we want and written them into our consent form. And we're also going to do a similar thing with the anesthesiologist. But we also need to know that not all hospitals are created equal. About 750,000 people contract an infection while in the hospital. On a yearly basis, in the United States, over 750,000 people get an infection from being in the hospital and what was done to them at that time. When we were back in the use pharmaceutical drugs part of the 7 medicines, I talked quite a bit about Stephen Herod Booner's book, Herbal Antibiotics. And I would suggest that anyone who is going to have surgery invest in a copy of that book and or listen to my shows here on Time Monk about herbal antibiotics and about antibiotic-resistant bacteria. The first few chapters of herbal antibiotics are probably the most succinct and clear primer on what antibiotics are, how they were invented, how they're used, and what happens to them in the end that I have seen anywhere. because the surgeon that you've chosen will often have access to operating at different hospitals, this is a good place for you to specify a facility. You want a facility that focuses on improving patient safety, that focuses on and includes innovative techniques such as timeouts. What's a timeout? A timeout is when the entire surgical team, the anesthesiologist, the surgeon, and the surgical staff go to the patient or have the patient come to them, and they all take 5 minutes to get to know each other. When I was talking to my daughter about this, she looked at me and she said, that doesn't sound like modern medicine. In modern medicine, you're just a figure. You're just a clipboard. She said, they turn everybody into clipboards. I said, yes, that's why it's innovative to actually talk to the patient before you did the surgery. And verification checklists in large letters. You would be surprised, maybe you wouldn't, at the number of wrong things that are amputated, wrong things that are removed, and so on. So a verification checklist at the beginning of the surgery really helps cut down on those kinds of mistakes, and greater transparency and accountability in the hospital. Many people have a poor outcome from their surgery, although they could have gotten more information before they did it, nonetheless should not be subjected to the surgeon saying, it wasn't my fault. It was the anesthesiologist who says it wasn't my fault. It was the surgical staff, and the surgical staff saying it wasn't our fault. It was the nurse's fault. And so passing the buck and passing the blame, and nobody really knowing exactly what went on. There are hospitals who are actively working against this so that whatever happens, someone can actually say, I did that. I'm the one who was responsible for that. Want some help with checking out your hospital? Go to capital C, capital R. We remember that stands for Consumer Reports, capital C, capital R.org. And then that slash, which starts in the lower left and goes to the upper right, hospital, little dash, ratings, capital C, capital R.org, slash, moving from left to right, hospital dash ratings is going to give you information on the incidence of 5 types of infections and how the hospital ranks on those, as well as other measures, direct measures of patient safety that Consumer Reports has been able to find. QualityCheck.org is a place where you can go and find out if the hospital is accredited by the Joint Commission. This is the standard body in the United States for accreditation of hospitals. Not all hospitals are accredited. I know this comes as quite some shock, doesn't it? I suspect that as my friend Patch Adams gets his hospital built and gets it going, that it probably wouldn't be an accredited hospital. That doesn't mean it's a bad hospital. Just means it's not accredited. If you really know everything there is to know about the hospital, if you've been volunteering at that hospital, if you know the staff at the hospital, it's not going to matter to you whether it's accredited, because you have enough background information to know whether or not you'll be safe. But if those things aren't true, then you probably need something like an accreditation to really find out what's going on at the hospital. Well, I've been mentioning anesthesiologists and anesthesia right along here. So let's stop for a minute and talk about it, because your life is in the hands of the anesthesiologist. You're probably not going to die as a direct result of the surgery. It can happen, but stroke and disability and that kind of stuff is more likely than actual death. But you can die if the anesthesiologist is not ready a second to do what needs to be done. The best quote that I read in researching on this topic was from an anesthesiologist talking to medical students who were saying that they wanted to be anesthesiologists. And he said, remember that your job will be endless hours of boredom. and moments of sheer terror. And that we are a well-paid profession because we don't get bored during those hours of boredom. We're able to stay alert. We're able to stay observant so that when that moment of terror arises and we need to act, we can act immediately. We can act from our intuition as well as from our knowledge. And once you've chosen an anesthesiologist, you can ask that anesthesiologist if during those times of boredom, of which hopefully your entire surgery will be, if they will read healing statements to you during surgery. Okay, this sounds kind of weird, but more and more evidence is accumulating that it's not weird at all. Andrew Wiles says, I am one of a growing number of medical professionals who believe that patients under anesthesia hear and are in a highly suggestible state. What's a suggestible state? A suggestible state is when somebody says to you, if you don't stop doing that, you'll have a heart attack. And you have a heart attack. You're in a suggestible state. We're not always in suggestible states. Somebody might see you eating an ice cream cone and say, oh, if you eat that ice cream, you'll have a heart attack, and you'll laugh it off and not have a heart attack. You weren't in a suggestible state. You were in a strong state. But when we're out under anesthesia, we are in an extreme suggestible state. And so it is important that we don't have our surgeons talking about their golf game. And again, I am not making this up because surgeons assume that the person they're operating on can't hear them. They will talk about all kinds of, well, I won't go so far as to say inappropriate, but perhaps not the most healing statements in the world. So get some healing statements together, give them to the anesthesiologist, and have the anesthesiologist read them out loud during the surgery. It will help everybody stay focused. A study at Beth Israel Medical Center in New York found that patients who heard positive affirmations on a tape played while they were under anesthesia required 50% less post-operative medication than a control group. Whoa, that seems to really work. What kind of healing statements? Well, you can just make up your healing statements. You can use these. Here's some healing statements for you. I heal rapidly and well. After this procedure, I will feel much better. My pain level is completely tolerable. All the beings gathered here desire my health. I am beloved and protected. Follow along that pattern. Make up some healing statements. Make a healing tape. Get the anesthesiologist to read it. Get them to play the tape. Prepare for surgery. Heal faster. A Guide to Mind, Body Techniques by Peggy Huddleston gives you 5 simple steps for preparing for surgery and follows along with exactly what you can do, including a companion CD of guided imagery techniques and healing affirmation statements. I sometimes hesitate to recommend Peggy Huddleston's work, and that is primarily because she is an aromatherapist and she works with essential oils, and you'll recall that essential oils are drugs. And worse yet, she works for a company, a multi-level marketing company that is currently under investigation. And I was talking to my daughter about this company today, and she said, oh, not only are they under investigation, but they just recently, this is 2017, went to an agency and said, we want to admit to you that we have harvested tens of thousands of pounds of endangered plants from South America and turned those into essential oils. And because they admitted to having done it, they were asked to pay a fine, and they were given the lowest possible fine. And my daughter said to me, so what does this tell us? That it's okay to rip off people who aren't of your culture, of their important healing plants, to use them even when they're endangered, and then so long as you admit it and pay a fine, we're going to say, sorry, but that's okay. So I don't like essential oils. I don't like the company that Miss Huddleston works for at all. And I haven't had an opportunity to review her book, but should it include any information about essential oils, I'm going to advise you to completely avoid that. There are also the PIP audio tape series, which aims to ease patient anxiety before, during, and after surgery. They combine guided imagery and positive messages against a background of calming music. And there is a 3-tape series for general anesthesia and a 2-tape series for local anesthesia. And again, I didn't have an opportunity to review this, but it sounds to me like these, and it says tapes, but I'm sure they're available as CDs at this point, although tapes are coming back, that they could be played during the surgery. Talk to your surgeon, talk to your anesthesiologist. Do they have tapes? What do they believe? Health Journeys for People Undergoing Surgery is an audio tape series by psychotherapist Bella Ruth Naparstek, which has produced powerful results in studies done at hospitals. The first tape helps the listener imagine successful surgery and contains affirmations, and the second tape is to be played during surgery, and it contains background music from the first tape. I'm wondering if it contains the affirmations. That's Health Journeys for People Undergoing Surgery, and of course, Sound Body, Sound Mind, Music for Healing with Andrew Weil. And this is music that he has specifically chosen to speed the healing process, and that can be played during surgery. There's a whole lot that we can do. We don't have to say, I'm going to be immobilized, anesthetized, and traumatized, and I have nothing to do with it. I'm just the body that's being operated on. No, there's a whole lot for us to do if we are choosing surgery. And there's a whole lot of things that we can ask about and make informed choices on, like what kind of anesthesia is going to be used. Is it going to be general anesthesia? That carries the greatest risks. There are often times when if you say, I don't want general anesthesia, a different kind of anesthesia can be used. Peter Pronovost, MD, patient safety expert at Johns Hopkins, says, overwhelming data show that when patients actively participate in their own care, they have far better surgical outcomes. So I guess next week we need to continue looking at what we need to do before surgery, and eventually we will get a week where we can talk about anesthesia, but it's not going to be next week. Thanks so much for giving me this opportunity, Gemini, to go so deeply into the 7 medicines to inform myself and hopefully to inform others so that we can all be healthier.
Thank you, Susan. It's always our pleasure to have you join us here at Time Monk Radio. And this concludes part 90 of our series, The 7 Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio.